Hello,
Dr.
good
Kumaji.
afternoon. Yes,
Oh,
yes,
is it
I'm.
now? Now is it okay?
Yeah, fine. Everything is fine.
I'm sorry, there was some communication gap.
Yeah, but
There is a
doesn't matter.
communication. There's
Doesn't
a
matter.
communication matter. We are,
Yeah.
we seek your apology. We seek
No,
your
no,
apology.
no.
No,
Fine,
no.
fine. It's fine, sir. It's
Fine.
fine.
Okay, okay. No,
Sometimes it
Vignesh,
happens.
Vignesh പറഞ്ഞു, Vignesh പറഞ്ഞു. No, Vignesh പറഞ്ഞു. It is okay now. It is true.
Uh,
Uh,
yes,
uh,
a very good afternoon to all the participants.
uh,
My name is Dr. Vignesh. I'm part of the National Digital Library of India team.
the-
We are the technical support partner for this webinar. Uh, for this, the PN Panikar Foundation has been organizing a series of webinars under their Quit COVID and Jan Vigyan Jagriti initiative. And the Panikar Foundation has organized 14 webinars so far. And today, this is the 15th webinar. The webinar session is on COVID-19 and mental health. And we have a very experienced resource person, Dr. Kumut Srivastava, with us today for this webinar. Now I request Balagopalji to formally welcome our resource person and the participants. Over to
Dr.
Balagopal,
Pal.
sir.
Yes. Thank you, Dr. Vignesh ji. Kumadi, hello.
Hello, hello,
Dr.
sir.
Yes, Dr. Kumadi is one of the seasoned, committed doctors of Lucknow. Whenever, whenever I go to Lucknow, she'll be in the she is in the front of the activities. I was very much impressed because with her smiling face, she is in the front of the activities of Janice Initiative. In fact, Janice Initiative, the organization, is run by Dr. Pankaj and mainly Dr. Kumut because the both of them are the real soul of this organization, and they are doing wonderful work in community medicine and in spreading healthcare in the schools and colleges, schools, especially in schools. And in fact, they are doing wonderful work, amazing work, we must say, in rural healthcare. The doctors, hitherto moving with only with the what you call high society population. Now they are going to the grassroots level and serving the public to keep their health in order because we need a healthy rural population. That's the
Really.
bone of the country. And I am grateful to Dr. Kumutji and her committed work, and along with the Dr. Pangaji. Pangaji is here. Pangaji, Pangaji, Pangaji. She will be because Dr. Pangaji will formally invite you to this meeting. Anyway, we will start. In between, I will find out Pangaji also.
Yes.
Vigneshji, can I kindly start the webinar with
Yes,
the
sir.
Dr. Kumutji. Kumutji,
Yes, I'm ready, sir.
yeah, please start your webinar, please.
Yes. Hello.
Yes, madam. Kindly go ahead. You are live
Yeah.
now.
Yes, yes, sir. I would like to present a presentation also. It will be easy for everyone. Okay, fine. Am I audible to everyone?
Yes, madam. You can share your presentation as well.
Okay, fine. You see, people are very much aware nowadays about health, and that is a very good thing. But usually, people are aware about their physical health. बहुत सारे ऐसे लोग हैं. I don't know. I should be bilingual or in English only.
Uh, I think it's a mix of all the many states. So it's I think
Okay,
it's better if I
fine,
think we have
fine.
south, north, every parts of the country.
Fine, no issue. So many people are suffering with many psychological issues, specifically in this pandemic, and God knows why people are not aware. And my motto of life is to make people aware about mental health because health is complete when you take care of your physical health as well as your mental health. And during this pandemic, we observed and we tried to help many people to uh, adjust with their psychological issues. Genes Initiative and other foundation, I'm associated with other foundations also. We run a helpline and we received lots of calls. even physical health related issues, which the cause is the mental health. So here I would like to say something which is important for mental health, and let's go for the this presentation first, which is related to pathway of well-being. It is very much visible to everyone. Slide is visible to everyone.
Yes, it's visible. So
That
you
is
can
fine.
just, yeah, you can just, yes, fine.
That is very fine. So, I am going to discuss the pathway for well being. What can be the, we can adopt one pathway for well being. Well being means your physical, emotional, social, and spiritual health. There are seven factors which are going to be discussed in this. Is how can you be a proper, holistic, healthy person? And I would like to accept the questions and answer. If you people have any questions, or you can put in chat box. I would like to reply. I will try to reply all this. So formally, thank you to Sri Balgopalaji and the foundation to invite me to discuss all these issues. Now I'm here with pathway for well-being. You see, these types of pictures we are facing from so many days, that what COVID has done. Lots of people are suffering with their bread and butter, as well as many people who are their corona fighters, corona warriors, and corona sufferers also. So the picture is clear. What about the COVID? I'm not going to describe of the COVID. The picture is very much clear to everyone. This is the old data, but the second or third waves are coming again and again because of the unlock. People started very much carelessness, and we are facing again few number of cases and issues. Even today itself, I heard a case in my colony itself. So like this, the picture is very bad, and we are all are suffering with pandemic, and lots of anxiety and insecurities are there in the mind. So just come to about the little bit about the history. That novel coronavirus disease that emerged at the end of 2019 began threatening the health and the lives of millions of people. In January 2020, the WHO declared the outbreak of a new coronavirus disease, COVID-19, to be a public health emergency of international concern. WHO started that there is a risk of COVID-19 spreading of other countries around the world. In March 2020, WHO has made the assessment that COVID can be categorized as a pandemic, and from March 2020, we all are facing, suffering, fighting with this coronavirus or COVID-19 issue. You know what about the pandemic, how it is a degree of concern, a fear, worry, anxiety, and a population of large number of people such as older adults, care providers, people with underlying health conditions. The main psychological impact in date is elevated rates of stress and anxiety. So things are going in a very bad shape, and people are suffering with so many things. You can see the picture how much issues are involved in during this pandemic because of lack of social interaction, because of lockdown, because of insecurity. They develop stress, financial problems, job issues, depression, uncertainty, tension, suicidal tendency, work pressure, insecurity, trauma, insomnia, lack of appetite, use of alcohol or lack of alcohol. That people are not getting proper alcohol, so they are suffering with this symptom, and people are feeling helplessness. So aggression, frustration, depression, anxiety has developed. Lots of irritability was developed, and some people have developed some physical health issues also. As you know, the WHO has described the health or well-being in the terms of physical, mental, and social well-being, and not merely the absence of disease and infirmity. So, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Well-being is experience of health, happiness, and prosperity. It includes having good mental health, high life satisfaction, a sense of meaning or purpose, and ability to manage stress. More generally, well being is just feeling well. Well being integrates mental health and physical health, which is related to mind and body, resulting in more holistic approach to disease prevention and health promotion. Furthermore, well-being is a positive outcome that is a meaningful for people and for many sectors of society because it tells us about that people perceive that their lives are going well. Well-being generally includes global judgments of life satisfaction and feeling ranging from depression to joy. So the pathway of well-being program promotes positive mental health and well-being through creative engagements. So we have many things to do to create a positive environment or to create a positive era, just to create a positive aura of good psychological health, good mental health to fight with pandemic. So these are the six dimensions of wellness which I am going to describe here: emotional, social, physical, academic, financial, and spiritual. Physical health well-being is about being safe, sheltered, and in good health, and it's closely connected to mental well-being. Because if we have a good physical health, definitely we feel that we are very much fit, healthy, fine, and happy. If we go good physical health, we will automatically experience better mental health and emotional well-being, which is very much required for a fruitful life. Academic or intellectual well-being represent a perception of enhanced learning, autonomy, and intellectual growth by the individual. It is manifested in the actions of the individual takes to learn on his own and in structured systems, process, and nudges of organization which enhances learning and knowledge. Social well-being, as man is a social animal and we interact with man to man, society to society, or man to society. That is the infrastructure, that is the lifeline. Okay, we are interacting socially, effective communication, social interactions, empathy, and all these social activities. So social well-being is when we have good relationships, social stability, and peace. Social intelligence factors include emotional intelligence, morals, upbringing, empathy, adaptability, and altruism are important to cultivate for social well-being. And during this pandemic, as people are not going to meet, so social interactions are forbidden. So people have developed lots of anxiety and undefined insecurity, which leads to their poor mental health as well as bad physical health also. Emotional well-being, if there is a one human, so emotions are there because they are innate, they are natural. The ability to practice stress management technique to cope up with stress, be resilient, and generate the emotion that lead to good feelings. Be resilient is just like a medicine to fight with emotional wellness. If you want to be emotionally fit, if you want to be a good emotional well-being, so please be resilient and understand the power of resilience and to adopt it. It's a very good thing to cope up with stress management, to cope up with emotional balance, for a good emotional health. That means you are going to towards a good physical or mental health. So, well being is a positive outcome that is meaningful for people and for many sectors of society because it tells us that people perceive that their lives are going well. Well being generally includes global judgments of life satisfaction and feeling ranging from depression to joy. And now come to the financial being. We all have faced different type of financial issues during this pandemic. Even some people unfortunately face some their bread and butter issues also. A very weird picture, very sad pictures we are going we all have seen or read about in newspapers and all this about financial well-being. So how this is very very important, that financial well-being is about a sense of security and feeling as though you have enough money to meet your needs still. It is about being in control of your day-to-day finances and having the financial freedom to make choices that allow you to enjoy life. Spiritual well-being, that is ultimate, and that leads to happiness and satisfaction, which involves one's values, beliefs, and purpose, a high sense of awareness, purpose, and alignment to core tenets that give meaning to an individual's life. So it's very important to be healthy at a spiritual part also. Now moving to the next. So with all these things, well-being integrates mental health and physical health, resulting in more holistic approaches to disease prevention and health promotion. Organizations understand the many facts that contribute to employee happiness and well-being can be effective action and are also able to influence their employees to make the right choices in their personal life. PIS. I would like to emphasize on this PIS. I would like to drag your attention over there as we all are discussing about the biological immunity specifically in this pandemic. So, Dr. Vignesh, is very important to describe here that we are very much aware that what type of things we can have in our diet or in our regular schedule to bring a good biological immunity to fight with coronavirus. Everybody is saying if you have a good biological immunity, so virus effect of virus will be null or maybe of minimum level, and the chances to recover is more and more. So same here, we psychologists are emphasizing about this the PIS, that is psychological immune system, and I would like to describe it as a protective device need to explore, protect, and strengthen our psychological immune system, which is an integrated system of cognitive, motivational, and behavioral aspects. PIS or psychological immune system help to prevent damage of mental health due to fear, worries, anxiety, insecurity, and negative emotion. Simultaneously, it helps if you have a good psychological immunity system, so you can fight with these things. You see, nowadays we are facing this pandemic issues, but the life is full of with up and downs, sorrow and happiness. So if we have a good psychological immune system, so we can fight with our anxiety, worries, insecurities, and negative emotions, as well as we can keep our physical health in a better way if you can fight, because there are so many psychosomatic diseases. You feel that you are having some physical issues or your physical health is in a bad shape, but the reasons are psychological. So that because of lots of tension, because of lots of anxiety, people develop some physical illnesses like allergy, like fake pains, or like heart issues, cardiac issues. So it's very very important, and we psychologists we are doing it from March, that people to make people aware about the psychological immune system. And I emphasize being mental health professional, I emphasize upon this more. So this is a simple way I am describing here the schedule. If we have a proper balanced schedule, so we can fight with with a good health issues. Spirituality, very very important. Connected with people, connected with your surroundings. Habits means good habit or a practice of a regular proper routine. Exercise, physical exercise is not only to keep people physically fit, it's a stress buster also, and you inhale more oxygen which helps brain functioning also. So physical exercise minimum 15 to 30 minutes is very very good. diet, because of no schedule, no proper schedule during this pandemic. People are doing work from home, so they are very late while bedtime, and a very late riser, and all these happenings, and not so many physical activities. So there is a non-systematic diet pattern people have adopted. So diet is very, very important. Regular, proper, balanced nutritional diet is important. Utilize time well. Utilize time well to do something creative, which you give some happiness. Your happy hormones should be very much active to fight as well as to keep you healthy. So utilize time well, good time, quality time. You have to, and this, see some good aspects of this pandemic we are facing. We all uh, felt that there are some good aspects, that now because of work from home, that people are not going so many areas, so people are connected with their family members. So utilize your time well and limit time screen. That's more and more important. And after these online classes, all children are very much using screen time, and unlimited screen time leads to many psychological as well as physical issues. And I am facing that, I am dealing with patients like this problem. Okay, one thing, that unlimited screen time, and every time uh, follow the news of the pandemic and follow the sad news as related to pandemic is uh, a problematic issues. And another time, unlimited screen time, which leads to the psychological issues, attention, vigilance, creativity, memory. All these are badly affected. And some physical issues like your eyes, your shoulders, your muscles, your sitting posture, your spine. And after all, some related issues of behavior tics has also faced during this. So limit your screen time is very, very important, and engage yourself in a creative work which leads to the happiness also. And you can explore yourself, that oh, I'm having this much talent also. So exploring talent this pandemic time is a very good aspect of this pandemic also. So now we are living with new normal formula, which is resume to work with PMS, physical distancing, mask wearing, and sanitizer. You people know that Janus Initiative has raising the, we are spreading lots of awareness about mask wearing also, and uh, distributing mask in all over India. With your foundation also, the Balagopalaji is very much active and very helpful in this program also. So PMS is the new formula, physical distancing, mask wearing, and using sanitizer to keep yourself healthy. So these are lots of things which you can do, and I don't know how much time I'm having. If I have some time, so I can say something more related to the issues. Dr. Vignesh?
Thank you so much, madam, for this wonderful insights on mental health. Participants, if you have any questions, kindly put it in the chat box. So I have a question, madam. I think
Yes, please.
in the last during this lockdown time, you have rightly pointed out there is a lot of suicidal tendency that has drastically increased. So in my neighborhood
True,
itself, I could
true.
see
Oh no.
at least four people committed suicide because of either with the anxiety of getting infected with
Yes,
COVID or
yes.
with job loss things. So what are the ways through which we can because all these people were like at very young age, not more than 30, 40, and they were earning good, they were in a reputed profession. How do we find them, and how do we handle this situation?
Right. Very true question, and very true picture ki nowadays we are facing all the psychological issues, including the suicidal problem. They all are exaggerated during this pandemic. We have faced it. We know it. So the very first thing is to make what I believe and what I practice, and we emphasize on this, Empowering your children, empowering your youth, empowering your adolescents. Nowadays we are facing this pandemic. Anytime any problem will come to our in our life, it is very common thing. So what we have to do, we have to empower our children. Empower our children in two ways. The very first thing is to for a good happy parenting guideline. Parenting is the baseline for children. Parenting is the baseline for adults and youths, and our adolescents, our youth. All over world we have the larger number of adolescents, and our countries growth is depending upon them. So empower your adolescence is a program where the first is parenting or happy parenting guideline, parenting education, whatever you can say. Second is empowering children to know about them and through life skill trainings. Life skills, with WHO has defined 10 life skills, which are the basic life skills, social life skills, emotional life skill, and personal or self-awareness related life skills, and thinking as a life skill which are related to cognitive development. Nowadays, very recently, new life skills has been introduced in this era, because use of technology and how technology is important for us for this purpose. And as people are not socially interacting or not moving or visiting their relatives or friends, so how we can keep ourselves healthy? So new life skills, so life skills training, adolescents education program, and parenting education is very very important, Dr. Vignesh, to make our children or our adolescents or youth empowered. I believe that to make people, to make children empower, just like a maintenance feed battery, to find with your own problems, to deal with your emotional issues, to struggle and not to give up any time. Second thing, many of the cases, many time we saw, we feel, or I observed it, even I treated the people, that the person who has the tendency of suicide, or who has a suicidal thoughts or negative thoughts, the person indicates through his activities, through his talks, through his behavior. We have to be a keen observer about this. So what is the way to be find out the if the person is sending some negative aspect? That is the very easy thing, and that is the only one thing, that is communication. Communication is very important, and we people are lacking with communication. If you communicate, if you converse it, if you talk with your children, you can come to know what is going on their mind, and from there you can assess if the child is having some negative thoughts, he is suffering. Sometimes we feel no, this is not a big issue, but it can be a big issue for adolescents who is fighting with adolescents or teenage issues also. I think I replied you, Dr. Vignesh. Would you like
Yes.
to add something?
Yes, that's fine, madam. So I think there are a couple of questions from the participants. There is a
Yeah,
question
please.
from Ms. Hemalata. Her question is how to build our immunity. Does immunity is through a chromosome that we have or something else?
I think madam is asking about psychological immunity. So for
Uh,
psychological immunity, the
yes, right.
as I said, a life skill training is important. Second thing is resilience, to be flexible. And nowadays, what type of people are facing? People wants everything. Everybody wants everything in a very hurry manner, without leaving his or her luxuries also, without taking pain. And there is no shortcut of a struggle of success. So resilience is a thing where we can develop psychological immunity. Accept the things as they are, don't try to change every time, And if it is required to be changed, change them calmly and quietly. And to understand that mental health is very important aspect. You have to perform effectively and efficiently in all aspects of life, whether the student life or whether you are going for a job where you are employed or as a housewife or any time, you have to perform effectively and efficiently, right? Add with your mental health. And every time it is not important to mark the things, to underline the things, to put inverted commas, to hashtag every time. I am not okay is also a okay. Sometimes I am not feeling good. Yes, it is okay. So acceptance and resilience and to communicate more and more. From there you can
Sure.
develop
So
psychological resilience or immunity.
the next question is from Mr. Raghuveer. His question
Ji.
is, what is the best way to improve mental well-being?
Mental well-being. The very first thing to accept that, to be aware about the mental health. And second thing, that as I said, resilience. Think many things which you don't feel, it will be going in a very bad shape. It will hurt your physical health also. So follow a proper routine, a schedule, or to make a to-do list is a very good thing. To keep everything in your memory is to better to write some things in your diary also. So mental well-being means physically healthy, emotionally healthy, and socially healthy. So keep all these things in an important way, and proper distribution, self management, and balancing your emotions. Everybody is having emotions. That is a natural thing. But where to exhibit and how to exhibit everything, why everything is pinching to me, that means that you have a weak psychological immunity. So for mental health, you keep yourself busy in a proper scheduled way and adopt one creativity which give you happiness also.
Yes. So
Next
there is
please.
a comment requested from one of the participants, Dr. N. Panika. So he says the passive means you're represented to cope with may not be adequate. Active means like empathy, sharing, and self-reliance are proposed in Sagajivan Swaraj. Please comment on this.
Can you repeat it please?
The passive means you
Oh, I got
presented
it.
to cope with. Yeah.
I got it. The passive means you presented to cope up with which may not be adequate to dress. Very right. I told na, it is not important to put hashtag every time. Active means like empathy, sharing, and self-resilience as I propose in Shah Vizan Swaraj. Okay. Empathy, sharing, self-resilience are the life skills which I am saying. You know, empathy, wearing another shoes in your foot to feel how it is painful or it is comfortable. Yes, it is an emotional, is empathy is a social skill, it is very important. Sharing and self-reliance, I agree. You see, for every relationship I have one formula. Formula means trust plus share plus a space equal to happiness. And unfortunately, a happiness graph of India nowadays, it has downfall. And we are carrying lots of things in our mind which is not important. Dr. Vignesh, next please.
So the one last question from or maybe a suggestion from Mr. Manjunatha. There is a lot of problems with child's mental health in this pandemic. So his suggestion is government should initiate a program to address this when they come to schools.
Yeah, it is important to, but you see, going to school is not only a schedule, it's a sharing, it's a stress buster, it's communicating with age group. So it is important. And you see, because of when July has come and schools have not opened, the children have developed lots of behavior issues also, because from till July, parents or the other persons have adopted the life in a different way. And sometimes we don't feel that a 6-year child is having some psychological issues also. So government should initiate programs to address this when they come to school. Yes, this is the issue related to government. I cannot put any remark on that, but we can do it as we are doing as a parent, as a psychologist, as a social activist. Okay, we are training our children, we are developing a psychological immunity with their parents as well as the biological issues also. So yes, initiation should be from government side, but I don't know when they will go to the school. Nobody can say. Even I don't know how many parents are ready to send their children to school. Everybody is scared.
True, very true. Uh, Thank you so much, madam, for the wonderful feedback and wonderful insights on this topic and patiently responding to the questions of our participants. Now I request Balakopalji to propose the vote of thanks.
I hope I have replied the queries.
Yes,
And you see, I would just want to say one thing, that yes, we are facing a pandemic. Yes, we are suffering. We have some fighters. We have some sad news related to pandemic. We have some corona warriors also. So that is a part of life. And life is not 2 + 2 4 every time. So we have to develop our psychological immunity for to fight with these issues also. And I'm very much ready to deal if the people are facing some issues. So I'm very much ready to help through telecounseling or through online counseling. All the very best to everyone.
Dr. Kumaji,
Yes,
Pankaj,
sir, please.
Vignesh ji, am I talk? Can
yes,
I
sir.
talk?
Yes, sir.
Is
Over
it
to you, sir.
audible? Or is it? Are you hearing? Yes, yes. Vignesh ji,
Yes, yes,
hello.
yes, sir. We can hear you. Go ahead.
Oh, yes, yes. Dr. It was a very amazing and very wonderful presentation. In fact, I enjoyed. I was keenly watching the presentation because of its simplicity and lucid way of presenting. And your English language also very lucid and very simple. So I enjoyed and not only enjoyed. I learned a lot of things. I was supposed to post the same question Dr. Dinesh uh, made it initially, because in Kerala also now today one of my staff members, very close relative, made a suicide in the well, in the house well. So
Oh,
there is an attempt. There is an attempt around in Kerala, not in Trivandrum. There are a lot of attempts of suicide because they are afraid of this pandemic. They are afraid. They
yes,
don't know what will be the reality, what will be the
yes.
real problems, etc. So
Undefined insecurity.
yes, yes, that is one of the very sad things, and some
Really.
social initiation has to be developed not by the government, by organization, all these society organization to make it as a point to console these patients. And now it is time, and that's why I would like to appreciate Dr. Kumiji for her committed work and her passion with mental care and mental what do you call it today's the mental COVID and mental health. The COVID and mental health, because very timely presentation, and because of some initial issues and
No, 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 not at all.
issues and lack of communication. And I'm sorry,
No,
I
no,
was
not at all. Forget it, sir.
I'm ashamed because
No, no need not to say all like this. I'm thankful to you that you chose me. You chosen me. You have given this platform to
no, no, it's
communicate with lots
because
of people.
you are one of yes, Janice Initiative is one of my strong partner in this COVID COVID-19 program, quit COVID-19 program, and you only give us
I
only
know.
a lot of mask, etc. And last time in Kerala, when we are facing this, what you call the flood, you only donated some uh, 1,000
Blankets.
the kambli, that warm clothes, blankets, warm clothes, and that was a boom to the poorest and poor. Even now there is a demand, but we could not supply that time only. Now you are doing wonderful work. We bank upon people like you to take our mission forward. Thank you, Kumit thank you very much, Vignesh ji, all the participants. We are grateful to you for attending this webinar and
Thank
kindly
you.
bear with
Thank you,
us.
Balagopal sir. Thank you.
Thank you, everyone. Thank you, Dr. Vignesh. Thank you, Balagopalji. I'm thankful to you, gratitude to you people to got this opportunity. I'm very much ready to work with you people in this way. Thank you so very much. All the very best. Regards.
Thank you. Thank you.
Thank you, all the participants. We have already shared the feedback from URL for this webinar. Kindly fill the feedback form and download the feedback, your certificate of participation. And tomorrow we have the session on ecoscaping skills and eco digital pathways to resource management at 11 a.m. So kindly register yourself when we have already shared the registration form URL here. So kindly register and join us tomorrow. So
That
we
is
once
good.
again thank our resource person, Dr. Kumut Srivastava, and Balagopalji for joining us here. Thank you so much.
Thank you. Bye bye, everyone.